Hi, my name is Lacey Schooling. Today I'll be demonstrating a postpartum assessment on my patient. So the first thing I'm going to do is knock, enter the room, and perform hand hygiene. Hi Shirley, my name is Lacey and I'm going to be your student nurse today. Can I just have you go ahead and verify your name and date of birth? Shirley Cost, 5/14/1964. Perfect. So I see you have some family in here. Would you mind if they left while we did this assessment? No? Okay, so at this point the family's left. I've closed the door and everything and provided privacy. Okay, so we checked your vitals and everything is good, within normal limits, so that's great, Shirley. Have you been having any visual changes, like blurred vision or seeing rings around the lights or anything? No, you haven't? Perfect. And how about pain? Are you having any pain? You are. Okay, where is that pain at? In your lower abdomen, so around your uterus area? Yeah, okay, and how would you describe that pain? A cramping. Okay, and does it get better during times, worse during times? Better in the hot bath and worse when you're breastfeeding. Okay, and how would you rate that? A 4 out of 10. Okay, well you are due for some ibuprofen, so we can go ahead and give you that when we're done with this assessment, and hopefully that'll help with the pain, okay? Okay, perfect. So the first thing I'm going to do, Shirley, is just assess your breasts because you're breastfeeding, correct? Perfect, and how's that going? A little difficult? Yeah, it's difficult first, but with some hard work, hopefully it'll get better for you. So I see some cracking and blistering around your nipple over here, and then I'm just going to go ahead and check the other side. Okay, and there's some cracking and blistering on this side as well. So I do have some lanolin cream I can give you, Shirley, and you'll just put that around your nipple and it'll help with the cracking and hopefully with that pain and discomfort that you're feeling. And then the next time you're breastfeeding, what we want you to do is put your call light on, so one of us can come watch you while you're starting to breastfeed, just so we can see how the baby is latching, okay? Okay, perfect. So I'm just gonna go over the head of your bed for the rest of this assessment. And I see they took your Foley catheter out yesterday. Are you still being able to void okay? Yeah, you went to the bathroom this morning? Perfect. And then bowel movement. Have you been able to have a bowel movement yet? No? Okay, I wouldn't expect you to, but have you been able to pass gas? You have. That is good to hear. Perfect. Okay, so you had a C-section, so the first thing I'm going to do is just pull down the top of your underwear and inspect your incision line. So the incision line looks good. There's no bruising or discharge or anything, so that's what we like to see. So then when you're discharged, when you're cleaning that, you just want to make sure it stays nice and clean and dry. And then if there's any discharge or anything, make sure you call the healthcare provider, okay? Okay. So the next thing I'm going to do is just check your pad, okay? And pull your underwear down a little bit more. And I do see a small amount of blood. When's the last time you changed your pad, Shirley? About an hour ago when you went to the bathroom? Perfect. So there's a scant amount of blood, which is the correct amount, what you like to see. And I'm just going to massage your uterus, okay? So I'm going to, with my non-dominant hand, cover the incision, and with my dominant hand, go into the belly button and massage until the fundus gets firm. And it is firming up. And I do see a little bit of blood, which is perfectly normal, Shirley. So at this point, it's the fundus is firmed up. We've looked to see if there's any discharges coming out. So I'm going to go ahead and change Shirley's pad. At this point, I would get new gloves and replace the pad for her. And then now we're going to switch over to a vaginal birth patient. So Shirley, you did give birth vaginally yesterday, and I did hear you have some lacerations. Is that correct? Yeah? Okay, so what I'm going to have you do is just flip over just so I can check those for you, okay? Okay, I'm going to go ahead and have you roll on this side. Perfect, Shirley. So what I'm going to do is separate the patient's buttocks, and there's no constant trickling of blood, which is what we like to see. And I do notice you have some hemorrhoids, Shirley. Are those old or new? They're old. Okay, are they causing you any discomfort right now? No, they're not. Okay, so we do have a stool softener that we're going to give you. If you'd like, it just makes that first bowel movement after birth just a little bit easier, and then it also should help not irritate those hemorrhoids any more than they are, okay? Okay, perfect. That's something you like. So we can go ahead and give you that after this and when I bring in your ibuprofen for that pain. At this point, I'm going to discard my gloves. I don't have a trash can over here. Okay, Shirley, so we're just going to pull down your blankets and look at your legs, okay? Okay. I see your legs are a little bit swollen. Would you say they're swollen? Yeah? Okay. So I'm just going to check for edema in her legs and ankles. And I see 2+ pitting edema. I'm also going to check her pedal pulses. Shirley, are you having any discomfort in your legs? No, you're not. Perfect. So the pedal pulses are bilaterally equal and bounding, which is good. Okay, Shirley. I'm going to go ahead and set you up, okay? How is motherhood going? It's going good. That is what we like to hear. So Shirley, sometimes new mothers, about 7 to 10 days after birth, experience a little sadness, mild sadness. We call that baby blues. It's perfectly normal, but if the sadness is very persistent or is getting worse, we'd like you to call your healthcare provider and come on in for an appointment, okay? And then if you have any thoughts of harming yourself or the baby, we'd like you to call 911 right away. Okay? Do you have any questions? No? Okay. And one thing I did forget to tell you during the assessment when you go home on discharge is if you have any clots bigger than an egg, we'd like you to call, or if you're using more than 1 pad per hour for 2 consistent hours, also to call us, okay? Okay, do you have any more questions? No? Okay, so I'm just going to lower your bed down. So we'll lower the patient's bed. Make sure she has her call light, and then we'll go get that ibuprofen and stool softener for you, okay? Okay, she doesn't need anything else, so we'll go get her medications and then document our assessment, the edema, and then we're done.